Hi guys, today's our topic is cardiac cycle and I will be talking about the events of cardiac cycle briefly. So what is cardiac cycle? Is the events in a beat. How many beats per minute? So we have 72 beats per minute and each beat will be occupying around 0.8 seconds. So the duration of cardiac cycle is 0.8 seconds if you consider 72 beats per minute. And let us think that the heart rate is increased. What happens to the cardiac cycle duration? So definitely the duration is lowered. So they are inversely related. I will give you an example. Let us think that the heart rate was 120 beats per minute. Each beat for 60 seconds. Each beat will be 0.5. So the duration of cardiac cycle from zero point 0.8 to 0.5 it was reduced. In which duration is reduced? Is that a systolic duration or a diastolic duration? In that the most compromised is diastole, and diastole is meant for filling, so the filling is compromised at higher rates of heart rate. And if you take the 0.8 seconds, 0.1 second is the atrial systole and 0.7 seconds is the atrial diastole. Ventricular systole is for 0.3 seconds and ventricular diastole is for 0.5 seconds. And if you see here, the atrial systole and ventricular systole are coming at a break of 0.1 seconds, and that 0.1 seconds is due to AV nodal delay. And explaining the events, we know there are two events, systole, diastole, and we don't talk much about the atrial diastole. It's simply a relaxing phase. We'll talk about ventricular systole, ventricular diastole, and atrial systole. First we'll talk about ventricular systole, which is having two phases, isovolumetric contraction, and this is a ejection phase. So what is isovolumetric? Iso is same, volume of the chamber, so it is contracting in a closed chamber. If you see here, the AV valve, aortic valve is closed, and here the bicuspid valve is closed. So both the valves are closed. Now the ventricle is contracting in a closed chamber. That leads to increase in pressure. This increase in pressure causes the emptying of blood into the aorta. Now the increased pressure will cause the opening of aortic valve and the blood is ejected out. So the two phases in the systole. And coming to the diastole, it is for filling. So whenever the ventricle is relaxing, the aortic valve closes as the pressure is more here, and as the pressure is lowered in the ventricle, the blood from the atria to the ventricle will come down. That is called as filling phase. And once the pressure gradient between the atria and ventricle is reduced much, now the atria contracts to push that extra amount of blood left out. That is atrial systole. Now we'll talk about those events here. Isovolumetric contraction, where the volume is constant and the pressure is increased, and isovolumetric contraction, as the pressure in the ventricle increases, the AV valve closes, and that leads to the development of first heart sound. Coming to the next phase, rapid ejection phase. In the rapid ejection phase, we'll have almost 2/3 of the blood is emptied out, and slow ejection phase, the remaining 1/3, and the left out blood after the systole is called as end systolic volume. Usually at the end of diastole we have end diastolic volume, which is 130 ml, and with each beat stroke volume 70 ml is emptied out and there is left out 60 ml. We call that as end systolic volume. So end systolic volume is 60 ml. Ventricular diastole. The first event in the ventricular diastole is protodiastole. It's the beginning of diastole and it leads to the closure of aortic valve that makes which sound? Second heart sound. Coming to the isovolumetric relaxation phase. To lower the pressure less than the atria, the ventricle is relaxing in a closed chamber. So isovolume. So same volume, pressure is decreased. And in mitral regurgitation, there is no true isovolumetric relaxation phase because blood is leaking from the ventricle to atria. So there is no completely closed chamber. Initial rapid filling, as the pressure gradient between the ventricle is and the atria is more, initially more amount of blood is filled with rapidly, and as it is only because of pressure difference, it is a passive filling, and the rapid filling will create a turbulence and that produces a heart sound called as third heart sound. And next, the pressure gradient is lower, we will get the next phase slow filling, which is also called as diastasis, and the rapid filling and slow filling will account for 80% of the blood that is filled in the ventricle. What about the 20%? As the pressure gradient is lowered, now the atria contracts to push that extra 20% of blood, which is active filling, and we call this phase as final rapid filling, and this rapid filling or atrial systole will produce a heart sound called as S4, and the amount of blood that is left out after the diastole is, we call that as end diastolic volume, which is 130 ml. Thank you.